Now, the increase in the number of new coronavirus infections in Italy mean there are fewer beds for the sick and hospitals are struggling. Hotels across the country are being repurposed to accommodate patients, giving the hospitality sector a helping hand, as well as the healthcare system. Our correspondent Georgia Orlandi found out more.
Swapping tourists with COVID-19 patients has its advantages. The plan is to have 20,000 COVID hotel beds across Italy. Although that target is still some way off, they are already starting to help relieve the pressure on the country's health system while sustaining a sector in need. According to the Italian Hotel Association, in a city like Rome, where 200 out of 1,200 hotels have reopened, only 15 are available for patients, with just 7 of them operational. The Sheraton is one of those. It has 169 rooms accessible for people with the infection. Here, asymptomatic patients are being accommodated, but so too are those who are not in serious conditions but still need treatment. Tourists landing in Italy who test positive are being brought here. We are 20 minutes drive from central Rome. This hotel has 50 rooms. Around 10 of them are currently occupied by COVID patients, mostly asymptomatic. The whole area is being constantly monitored by the police, and it's one of the busiest so far. More than 500 COVID patients have stayed here since April, with the hotel often reaching full capacity. Regional authorities offer €30 a night per each guest, and that covers cleaning and sanitizing costs. That's nearly half of what they would normally receive. But the hotel general manager tells us that with revenues going down by 70%, if it had not been for this opportunity, they would have shut down like many other hotels.
I had to ask for loans to continue to pay suppliers. But thanks to this scheme, I managed to keep the business going, to pay taxes, the rent of the premises and the utility bills.
The last time hotels were used to accommodate people during an emergency was a few years ago when Italy was struck by earthquakes. That's why, for many, including this one, such demand is unprecedented.
It's the first time we've experienced something like this. In the past, we used to give 1, 2 or 3 rooms once every 5 or 6 months, following, for example, a gas leak in a building.
As it's difficult to guess how long the pandemic will last, Antonella De Gregorio is quite concerned about the future.